I'll talk about vitamin B12 and folate for the treatment of depression. So B12 and folate are essential nutrients. They're B vitamins. They participate in many biochemical processes in the central nervous system and in the body. And they do play a role in depression treatment. And recent research studies are confirming that both of these nutrients are useful and important. So deficiencies in B12 can disrupt brain development, and inadequate levels can contribute to a variety of neuropsychiatric symptoms and also to inflammation. And B12 is difficult to absorb as a vitamin. So it's not so uncommon to be low unless you're supplementing or unless you're eating super well and your gut is healthy, there's a risk you might be low. This is especially an issue for vegetarians because B12 only comes from animal products. So even when you supplement, if your gut is not healthy, you might not be absorbing this vitamin very well. So it's important to get a blood test and to check. You can also get a blood test order one yourself, but you should have a doctor interpret the results. In Europe, the cutoff for normal is higher than in the US. So, even if it says normal, it may not be adequate for good health. And supplementing with liquid form or easy to absorb forms or sublingual forms may be better for B12, or some people may need shots, which used to be very common. You would go to primary care and get a B12 shot. It's not so common now. I have many talks about inflammation. You can check those out to learn about B12 and inflammation. So let's talk about folate. So inadequate folate, which is another B12, will lead to an elevation in homocysteine. So you can check homocysteine level to know if something is off. And augmenting antidepressants with folate, particularly L-methylfolate, is now an evidence-based treatment for depression. There's a medication that's approved for the treatment of depression that's basically folate at high dose, 7.5 milligrams and 15 milligrams. You can also get this form of folate, L-methylfolate, over the counter as a supplement. There is a very active and lively debate about whether MTHFR gene variations play a big role in determining who should be taking folate and how much folate. MTHFR is another lab test, easy to check, not very expensive. It might be very useful to know if you do have a mutation. People with mutations in MTHFR gene need a lot more folate to keep that metabolic loop going at a good rate. Otherwise, there are metabolites that accumulate, and there's trouble with methylation and trouble with detoxification. So basically, you want to keep your homocysteine level low and B12 and folate levels adequate or even high if you have mutations to prevent a variety of issues. So L-methylfolate has been tested now in many research studies. It's safe, it has minimal side effects, and it is an evidence-based treatment. I do see in clinical practice that some people do have side effects. They don't feel well if they start folate at high doses. So we start super slow and increase gradually. And who should be considered for L-methylfolate? So especially individuals with treatment-resistant depression or with inflammation or with high homocysteine levels or with these genetic polymorphisms in MTHFR, such as double 677T. And since folate has pretty low side effect profile and potentially is beneficial, it's a reasonable thing to add to a depression treatment regimen. Run it by your prescriber. B12 and folate play a key role in depression treatment and prevention, and they're promising non-medication treatments that can be added by most of us. For a personalized approach, ideally get genetic testing, check your blood biomarkers, and treat based on what's actually happening in your body. Thank you for joining today, and please feel free to share about your own experience with folate and B12 as a treatment for depression in the comments section.